Hello, welcome to a new episode on our podcast. And today, if you want to learn more a little bit about your mouth hygiene and oral hygiene, this is the episode for you. I want to say hello to Dr. Sajeev Vasalan. Hey, Dr. Sajeev,
Hi.
how are you?
Fine, thank you. How are you?
I'm great. Thank you very much for coming to this episode. Let me just present you. You are from Jama Dental Center, and you are an expert in all sorts of dental procedures. We're going to discuss about them. It's a very important topic that not many people, take very good dental hygiene for themselves. They do sometimes. I know some people that only do, they only brush their teeth once every day, not even twice, not even in the night. What do you think, Dr. Sajeev, that dental care is not such a big issue for people?
Yeah, see, dental care, it should be on a day-to-day basis. Like, you have to be thorough with their brushing. They should allocate proper timing, at least after food in the morning and after food in the night. That is a minimum required. But if they do that, a lot of problems happening with these many patients today can be avoided.
Definitely. And I want to, before we go a little bit deeper into dental hygiene and all those very important things, tell me a little bit how you even got to become a dentist, out of all the specialties that the doctor can have.
To be honest, in the school, I was influenced by a popular dentist in the local area there. That was the first time I got attraction towards the career. But only once when I got entered into the university, and after first year, it was a bit of struggle. But later on, I started having a kind of passion develop for the profession. So then onwards, I started enjoying it.
Amazing. And just walk us around, what does, being a dentist means? What kind of specialities you have? What types of services or treatments do you give?
See, dentistry has evolved a lot from the earlier days now. Okay, there are a lot of specialties. Many popular specialties like orthodontics, implantology, prosthodontics, kids specialty like pedodontics, then endodontics, of course, that is related with the root canal treatments. And nowadays, cosmetic dentistry has come up, evolved a lot. It has evolved like a specialty as it is now.
Does it include also Botox in the face, or is it?
Yeah, see, actually, I'm also trained in Botox and fillers because I'm Maxillofacial surgeon and to start with. So we are trained in that, and it is helping a lot to transform the face. And as a dental background, we have deep-rooted studies and knowledge about the facial cosmetics and aesthetics involved. So we are in a better equipped situation where we can assess in the facial aesthetics and impart proper treatment to patient, not only the dentist in the dentistry, but also in fillers and Botox. That helps a lot to transform the beauty of the patients.
Definitely. And a lot of people are a little bit afraid of coming to a dental center. They're afraid of the pain, they're afraid of the drills, they're afraid of all those things. What can you say to someone that, has a pain? Most of the time people have pains they sometimes ignore in their mouth or on their teeth, and they don't want to come to the dental center. What do you have to say to those people?
See, fear and in a higher form it's called phobia. Okay, these are the two things that keep the people away from seeking the treatment on time. It will only make their situation from bad to worse. Okay, you have to manage the fear and phobia. But most of my patients, once they come in, when they go through that initial stage of fear and reluctance to get the treatment initiated, but once we are through that first stage, then in the later appointments, I feel almost I can say 100% of the patients are much more relaxed, because the way we enact the proper treatment, like with the minimum or no pain, make them feel that, okay, this is not like what we heard of dentistry. The problem in dentistry, the main thing is the needles. Okay, when they see needles, they get the fears initiated. So then they get, reluctance to go through the treatment. They run away from the treatment like that. But see, if you do proper way the anesthesia, like applying the gels, like anesthetic gels, and the relaxation techniques like the conscious sedation and so many things, they will not be feeling at all. And some patients, after when I given the anesthesia, they say, are you done? the injection like that. So they will not feel at all. That way we can do it nowadays. There are a lot of measures. We can make sure there is no pain involved. We can do painless dentistry.
Amazing. So that's also very, very calming for a lot of people that really afraid of this pain. And I've heard of a lot of friends that have suffered to a lot of pain on dental centers. So it's really good that you say that. I want to discuss, we will talk about Botox and fillers in a different question, but I want to start with the actual, veneers. It's one of the very common treatments that people do, because sometimes people have, disoriented teeth and they want to get them a little bit better, a nicer smile. So tell us a little bit about veneers and about this treatment.
Yeah, the veneers is, as of now, it has evolved a lot. Like most of the patients are aware of it. It's a full smile makeover. Why it has come to that much of important stage in dentistry? Because see, there is a ideal proportions of a face. How a face can have the most perfect smile. Okay, there are some arithmetics involved in that, like a round face, a squarish face, elongated face, oval face, and the smile curves. All these things are how studies and scientific way of assessment. And first, for a face, we can design a smile, and our target is to reach that area in a proper way. Like for that, we need to first have to get the foundation correct. A lot of other treatments, like for example, some patients come with extremely crowded teeth and protruded teeth. They cannot close their lips. Okay, it's not at all a straight profile. So in that case, we have to first do the orthodontic treatment to achieve a good profile. Then we can do the veneers. Veneers are actually a shell-like artificial teeth, which is glued onto the teeth. Simply to understand is simple like that. But some people who have the spaces, it's easy to fix, spaces between the teeth. But before start anything, we have to have a painless, hygienic, clean mouth. So that we have to create first. Then we have to go through all these things. First, take a picture, take models, assess their situation as of now. Then come to a treatment target and how we can reach there. For that, we use all these things like first cleaning, treatment, fillings, if any root canals, any bad teeth to be removed, like that. Correct the profiles using, maybe we can use aligners or braces, get a good profile so that we don't have to reduce the teeth too much. Then we can enact the proper final act of veneers. Veneers can we do with minimum preparation, or minimum preparation means cutting the teeth, or no preparation at all. And classical preparation, we have a full preparation. We have to cut the teeth down. So those who have too many cavities and all, we have to do that. So minimum prep, maximum prep, or no prep. These are the different types of veneers. Materials are different. Ceramics, zircon, Emax, so many veneers are available. Okay, the aesthetics are different with different materials. Also the cost involved is also different. Durability will be different. But finally, we can have a pleasing smile. That is the main thing.
Amazing. And you mentioned braces and many other things that people have done more in the past. Now it's been less frequent. What would you recommend for someone to have? What should you say to someone that would ask you, what should I get, braces or veneer? Is it even an option sometimes for people, or it's usually about their own state and face and right, as you said, the strength of the teeth?
Yeah, it's a situational assessment. Like some patients who have a very nice profile teeth, there is no more proclination or crowding. If they walk in, we can assess and see it like that. We can just go straight away to veneer. But ideally, to reduce the minimum cutting of the teeth, most of the patients have to go through a minimum orthodontic treatment, either using the normal braces or the aligners to get the proper shape of the teeth. Then we can put on the veneers. So that means to say that not necessarily every patient has to go through the orthodontic treatment, but most of the patients can get the veneers done directly.
Amazing. And we talked a little bit about pain and anesthesia before. I know that there is some sort of a process called the conscious sedation. So how can it help us, be calmer, be more relaxed during orthodontic process?
Yeah. Conscious sedation is a beautiful treatment option because those who are very apprehensive or having fear or phobia, that once they get this conscious sedation, they get to stage of relaxation. Okay, the apprehension is reduced, the fear factor is gone, and they also it will have a pharmacological impact to relax them, and they will be more acceptable to the treatment. Psychology, they start accepting the treatment. Of course, there is no anesthesia as it is, but it helps to reduce the pain. Analgesia, it is there. And also it has some kind of amnesia. Amnesia means they forget about what happened. So that helps them for the follow-up treatments. How long they
So they can't be fear of something they don't remember, right?
Yeah. So they sit here for some time, like half an hour, 1 hour. They go through all these injection procedures, root canal treatments, or whatever. If you, from the outset, you think, in the mind, you think it's a fearful procedures. They have gone through that. They may not have realized that. Maybe if they have video, they say, oh, have I sit through all these procedures without being not reacting like as I expected? They feel themselves, funny how they went through all these things. So that means they'll be relaxed to accept the treatments. So once they are sedated, we can add on to the comfort of the patient, the injections or anesthesia. So they will stay throughout the treatment, and we can do faster. There will be multiple treatment procedures we can do in same sessions, so we can reduce the total treatment time. And once they go through all that, I realize the next treatment session is much more acceptable, easier for them.
Amazing. So it's also a very, very interesting way of treating those fears, those phobias, like you mentioned. We talked a little bit before about cavities. It's also a very big thing. It's also, maybe the most common problem with teeth. We eat too much sugar, too much fat, too much of those bad things, and we don't keep our dental hygiene correct. So we get cavities. How do they form, and what can we do to reduce them or to avoid even having cavities?
See, it's a very good question about the prevention because, many kids from early in their life, now they are used with this sugar-containing sweets and whatever it is. And most of the sweets are sticky, like candies and all. They stay on the teeth surface, okay? And if they don't remove this chocolate or candies, whatever remaining on the teeth immediately, it can stay on the teeth surface and create a kind of a damaging effect forever. Like it creates an acidic situation. It helps to dissolve the enamel. It initiates the decay process, and it is continuously going on. So most dangerous is consuming too many sticky the sweets or chocolates, plus they're not brushing properly. And on top of that, the frequency is more now. They keep on taking every now and then, like every 1 hour, 2 hours, they keep on taking. So that once the chocolate something is there, almost like 2.5, 3 hours, the damage is there. So you have to clean it before. So before that is over, they are consuming another round of these sweets. So the process is going on. So they get the decay very fast. And I have seen many patients, at the young age, they have too many decays. On the contrary, there are some kids who are totally aware of these things, take care of the brushing early. We cannot see any cavities on them. Means they are used to brushing at least twice a day, after breakfast and night before sleeping. They make sure that they brush their teeth. One practical way to advise is to not to take too much of the sweet or sugar, it's sticky chocolates, but brush immediately if at all you need. And after taking that, make sure that you eat some hard vegetables like cucumber, carrots or something, so that naturally it rubs off the chocolate from the teeth surface, and follow it with brushing. Use some fluoride containing toothpaste regularly. Fluoride helps to reduce the decay of the teeth because that makes the enamel more resistant. So frequent brushing, reducing the frequency of consuming the chocolates, consuming too much of fibrous vegetables after that, and do fluoride toothpaste or fluoride varnishes. That's all.
Amazing. So it's really easy, but people still, fail to do it, and then they suffer a lot from their teeth, and they're coming for all those needles and injections to your center. So it's much better to prevent it, and it's better safe than sorry, they say, for many other things also that. And about, we talked a little bit about diet. So you mentioned chocolate, you mentioned sugar. Is there any other things that it's good for us to eat, or it's better for us not to eat in order for us to keep good teeth?
Yeah, as I mentioned before, any food is okay, other than something which is having high sugar content, sticky stuff that stays on the grooves of the teeth, and once it stays there, it creates an acidic medium. So that is a problem. So just keep away from that diet. Reduce the frequencies of sticky chocolates. If at all they need, take it once in a while, and immediately make sure they brush their teeth, keep the surface clean. They can do few things like there is something called pit and fissure sealants. That means the younger age, usually the orthodontist is the one specialist to do it, but even the normal GP doctors are doing it. Just seal the grooves on the surface of the teeth. So there are no more grooves. It's all become a smooth, like shining surface. So nothing stays or get attached to the enamel. So it's easy to keep clean. So at the very young age, they can use that technique to make the teeth surface smooth. And top of that, use the fluoride treatment. So the teeth becomes resistant. They can prevent the decay. That means a lot of treatments can be avoided, like the fillings and root canal and all these things.
Definitely. And what about the scaling? When you clean at the dental center your teeth, is it something that is important to do? For how frequently we should do it?
Scaling is simply to say it's a procedure where we remove the deposits on the surface of the teeth, on the enamel as well as on the root, so keeping the teeth clean. So it's the early stage when it forms, it is called plaque. The deposits around the teeth called plaque. Once it becomes harder, when it stays long, harder, called calculus. Calculus is difficult to remove. Okay, it's hard. It need professional help. A dental hygienist or a dentist has to remove the calculus. Then only it can be clean surface. But plaque, in the early stage, if everybody have a good intention to keep their teeth clean, brush with a proper technique, spend more time, they can take the plaque away from the teeth, so they will not be having decay, as well as the gums will stay healthy. Gums, if it's the plaque deposits stay around the gums, it will slowly start receding, get gum inflammation called the gingivitis. And gingivitis stays longer, it became a chronic situation. It's called periodontitis. The teeth start getting mobile and weak, bleeding, bad smell, so many things. So it can be prevented by proper scaling. Ideally, everybody should have a checkup every 6 months, so that minimum scaling is enough, and a screening of x-rays and all to evaluate the overall situation.
Amazing. So we have 6 months. It also was my next question. One is the good frequency to come to a dentist. So definitely 6 months is a good one. I wanted to ask you, because you've dealt with so many people in your clinic, and you help them, creating, eliminating the pain, or having them having a better smile or better face. Can you share with us one of those stories of someone you helped him or she helped him create a better face for himself?
Yes, I have many patients who are so happy with the results I have. There are so many patients who are so shy to smile. Okay, some people are so shy because of the decay, the discoloration, protrusion of the teeth. They cannot close their lips. It affects the confidence of one person. Okay, so when you have a beautiful smile restored, it reflects on all your daily activities. Okay, the confidence is back there, and in return, you see the patients appreciate in the end how much they have transformed. I have many, like even innumerable, like doctors, doctor patients are there. I have a lot of faces are going through in front of my mind.
Remember one in particular? Did you remember its story?
Still like this is somebody like one. Special case is one boy. He was he's a mentally not like absolute normal. He was so shy, it was so difficult to initiate the treatment. But then we initiated treatment, and finally we corrected the position. It was a protruded jaw, reverse. Everybody refused to get the proper treatment for him. And his mother was one of my old patients. So she was a trust in me. She brought him to me. I treated him. Now he gone up to the age of like 15, 16, started from the age of like 9. So we had to do the orthodontic treatment, hygienic treatments, we had to do the expansion, complicated treatments, but all the time, every time he'll be afraid to start with. But then slowly he won the confidence in me. So then we complete the treatment, and now he's mine, and now he's almost with all these treatments around his self-esteem is so good. So he come with a beautiful smile and hug me, also say thank you uncle and all these things. I feel so happy.
Amazing. So it's such a great thing to see the joy of people after you
Yes,
give
of
them the
course.
right treatment, right? Definitely. And we spoke a little bit about Botox and fillers, like you mentioned. So, and I know it's a big trend now, especially in Dubai, in other parts of the UAE, for women, sometimes for men, to improve and to straighten everything up. So tell us a little bit about it. How much of a painful procedure is fillers, and what is the best tips you can give for someone that want to do it?
See, Botox and fillers are very common now. It's very simple procedures. Each session maybe a single filler or single Botox injection. It may not take more than 20 minutes, something like that. You can do very fast, not at all painful. We can put topical anesthesia properly, and you apply the cream and gel. It gets the surface numb, so you will not feel the prick at all. You will not feel. And it transforms somebody, maybe for transition, for time being only, but improves a lot. Like somebody who have wrinkles on the forehead, somebody who have wrinkles on the both sides of the nose, like the folds, wrinkles that make them look older. And the size of the lips there's a proportion like upper teeth and upper lip and lower lip. So we can restore this lip and lip margins easily. Okay, rather than going through surgical procedures, it gives a proper architecture of the lips. So very simple way, easy. Only thing that it might last for, depending on the material used, for like 6 months to 1 year or 2 years. That's a shortcoming, but still it's a fair enough time. Okay, a procedure which is where it's a surgical correction of face and all, it can be done, but it has to go through a lot of bigger procedures. So Botox and fillers are here to stay forever, and it transforms somebody's smile so fast, easy way. Okay, so it should be really, people should know more about it and should be supported.
Yeah, but I know that a lot of people, when they come to have this treatment, they fear that it might deform their face. It might give them unnatural look. It might look, weird for people. And I saw some results that give that way. So how can you prevent something like that from happening?
See, Botox should be, it's a kind of medicine that makes the nerve a little bit numb. So it takes away the wrinkles, make the area not that much moving. Okay, especially look at the forehead. If somebody who frown, there are a lot of wrinkles. So if you put Botox, they cannot frown, the wrinkles will be gone. But that effect stays for like only 6 months. And but there should be properly trained hands doing it. Okay. It can go wrong if you do wrong materials, wrong fillers in wrong place. So there are proper area where you have to deposit the fillers. So if you go in the wrong place, it can move around. Okay, there are some planes of the muscles and the fascia under particular area. We have to, professional knowledge should be there to properly inject the fillers and all. And also depending on the materials, it stays longer. Okay. So each material have its own indications that doctor can decide, and we can discuss it openly with the patient before we start. And it gives fillers, it stays longer. For example, some people who like to have a prominent chin, you can have a filler, and that filler material can be of a different type. Okay, and should be deposited in properly and just above the bone, so it should be staying long time.
And are there any cases you remember that, because it's also the thing about trend is that sometimes people that don't really need it or don't need it in the right places that they think it's right for them, they come to experts and they say, hey, give me bigger lips or as they say, prominent chin or something like that, and you see that it's not proportioned with their face. It won't look as good as they think. So have you came across to those cases in your clinic?
This is personal choice of some patients. We have to respect that. Okay, but we have to tell them upfront what is actually ideally suited for them. But if they decide on top of that, we have to emphasize on their choices. For example, some people who would like to have, they come with a picture of some, heroines or somebody's face and they want this kind of lip. So that may not be suitable for that patient's face. Okay, we can show them at least somewhat closer to that by animated, pictures and of that. See, for example, somebody who have a fuller profile with long profile may not having any problem with the bigger lips. Okay, but somebody who have a concave profile have a bigger lips, it look like this.
Look like a duck.
Okay, so how it suits in a different phase, we have to assess, inform the patient what is going to happen. But still on top of that, if they wish to have, we have to oblige that, but at the patient's responsibility. Okay, but generally to say, for example, even the whitening cases, veneers, we can put a flashy white teeth, we can put a slightly white teeth, we can put absolutely normal. Patient to patient varies. Some patients say, I don't want anybody to notice that I have an artificial teeth. So that patient will be happy to have a normal colored teeth. Okay, slightly on the whiter side. But some patient doesn't care. They just want flashy white. Okay, they say this way, oh, I want that.
Want to make the people blind when they smile.
Okay. Yeah. So it's their choices. But it's to us is to inform them different kinds of how they look. There are a lot of smile designs out there. We can show them how it looks, the color, the shapes. All these things we can show with the animated pictures now.
Amazing. So it's also good that you emulate what would be the result for them. Dr. Sanjeev, I wanted to ask you because we talked about veneers and having a full smile, but some patients sometimes have only one teeth left missing or two teeth. In that case, what are the best treating possibilities we have?
See, in olden days, we used to have the conventional treatments, like if somebody who lost a single teeth, we have to go for a bridge. Okay, that means a bridge is like it's supported on both sides. Like one teeth missing, we have to take support on the teeth on the right and left, make a three-piece bridge connection. So we have to put two crowns and one in between. That is the way. But nowadays, it's all easiest with implants. Implants we put directly to the missing teeth, just like it replaces the lost root with the implant, and we build up the crown on there. Exactly, it looks exactly. Nobody can differentiate between the implant and the real teeth. So they will be happy to have a missing teeth with as implant in a exactly like the natural teeth before. In another situation, those who have multiple missing teeth, suppose you don't have any teeth, then we can go for implants in a full arch situation. Like we have to put at least like 4 or 6 or 8 implants on each side, and we can connect it with the prosthesis that looks absolutely like a natural way. So in terms of aesthetics and in terms of function, they'll be back to normal. No need to go through the olden days of the dentures. Okay, and the people can have their life back to normal, absolutely like before, and that too in a very normal time. Like we can have a same day implants. Like if those who no teeth come to my clinic, I'm doing treatment a lot. Like we put 6 implants or 4 implants or even 8 implants, sometimes depending on the cases. We give a full smile the same day. Okay, and the patient can walk in the morning, evening they go with a full smile. But at the same time, the treatment is not over. They need to get it replace the teeth maybe after 2 months or 3 months later on. But in the beginning, they come in without any teeth and they go back with the teeth. That much is advanced nowadays, the treatment.
Amazing. And I remember, I don't know if you talked about it, but my grandmother used to make the fake teeth, the fake
danger teeth.
For people. So I've seen that all the time, and to see that now implants made it so much easier to do, and without so many of the hassle, going out, putting the teeth to clean and all those things, and it looks so unwelcoming, those fake teeth. So it's amazing that it's any different. And regarding, let's ask it again about the pain. How much pain involved in such an implant operation?
See, implants, it's much less painful now because, see, we are using a lot of techniques like the pre-surgical guides. Like before the final appointment, we study the case with the proper scanning, then CBCT, that means computerized, tomographic X-rays we take. So that helps us to plan beforehand how and where we put the teeth. So we don't have to open the gums like a surgery to put the implants. We can directly put the guides, and with the guided way we can put the implants in the proper way as the area exactly where we want. without subjecting the patient to a bigger surgery. So there is minimal opening. That properly, most of the time we don't have to put sutures or the sutures. I hope understand like the stitches. So the whole procedure, maybe 6 implants, we can finish in 1 hour. Okay. Similarly, the lower also another 1 hour. We take the measurements, and another 4-5 hours the teeth is ready. Okay. So patient come at 10, 12, we finish. We take size by 4, 5, 6 o'clock. They will have their teeth. Okay. And then no more stitches. But post-procedure, they might be put on like some analgesics, and sometimes depends on antibiotics, mouthwash, and topical anesthetics. And they can have soft, light food one day, and a day later they can be back to their almost normal diet. But important should be on biting with less force, cleaning well, and maintaining the hygiene properly, and proper follow-up visits. That's all.
And as experienced dentist, a lot of people come to your clinic every day. What do you recommend for someone that wants to get a dental treatment from any sort to do before he comes to the dental clinic? What he should do? Should I brush my teeth? Should I avoid brushing my teeth? Should I be prepared with something to make it easier for me and easier for you as well to treat?
Yeah. Patients should develop this habit of brushing the teeth, of course, okay. And as I said before also, after breakfast and after dinner, it's mandatory to brush at least 3 to 5 minutes. Make sure the brush is reaching everywhere of the teeth, like outside and inside. Some people, they say, I brush 5 minutes, but they keep on brushing on one area only. They have to move.
Only this side or, yeah.
They have to brush it around. They should know the proper way of brushing, and do flossing. See, flossing is something is underused nowadays. Okay, and see, all of this water flows and everything it's all helpful. But in some particular case, like we have to use the threaded floss. That's important. Threaded floss, in some areas, that will be the only way to keep it clean. But that area we have to emphasize on the patient. This is the area how to use it, and they have to use that. The water floss, they might clean well, but maybe up to 90%, 90%. But still, they have to rely on some manual cleaning to make it perfectly clean. So if you are particular, everybody, once they enjoy the benefits of keeping it clean, they don't have cavity, they feel fresh breath, no smell, no problems, no pain, and they start enjoying it, then they will maintain it. But until everybody used to that kind of hygienic ways, they are prone to develop problems. So my advice to them is to have healthy food, reduce the sugary stuff as much as they can. But of course, we cannot keep away from the sugars. People know, everybody crave for that. But then use other measures to reduce the bad effects of that. Brushing, take vegetables and everything on top of that, clean it. And this trays, you can use the trays, closer trays which with the fluoride gel that makes the teeth stronger. So many ways are there. Seek professional help every 6 months. And also, the most important thing is catch the problems at the earliest. The moment they feel a decay is developing, seek the professional help. The more you delay the treatment, it can give you a bigger cavity, it can develop a root canal, then you need to have injections. So dentistry, as early as possible, you start the treatment. It is going to be a very, very simple procedure. If you delay, you have to pay a price.
Yeah, pay a price and also pay a lot of pain. Yeah, with the big operations and everything. Dr. Sajeev, we're coming to the end of this podcast. Anything you would like to share with our audience before we finish?
Yes. See, dentistry, no need to think about anything, with the fear factor nowadays. The modern digital dentistry is all about having all the treatments without any pain. So no need to be reluctant to seek any treatment from a properly equipped clinic. That's it.
Right. And as you said, seek your professional help as soon as possible, and then you can avoid a lot of pain in your wallet as well, because you're going to do some easier operations. Dr. Sajeev Vasalan from Jama Dental Center, thank you so much for being with us today.
Thank you. Thank you so much.
Thank you so much. Thank you so much for listening to us. See you next time. Bye-bye.
Bye-bye.